incorporated, we incorporated in 2018. So just to provide a little bit of an update here, we are starting 2025 in a very favorable financial status that is enabling our board to look at opportunities to distribute funds to CVSOs that they can further distribute to help meet the needs of veterans in their counties. We'll be reaching out to CVSOs in our region to learn more about what their veterans are experiencing in terms of unmet needs. We're excited about this opportunity and grateful for the generosity of those individuals and organizations that are contributing to our ability to pursue this kind of assistance to veterans in an effort to avert the need for crisis services. Last week, the board met for our annual meeting, and we sadly said farewell to two invaluable powerhouses in our VetsCAN history as they ended their terms on the board. And that's Connie Walker, Connie is a force unto herself. And right now she's manning our Zoom yet, but she's a founder of VetsCAN and just has been a leader through the different phases of implementation of our organization and the evolution of our organization, and responsible for establishing partnerships with critical supporters such as the Bob Woodruff Foundation. We also said farewell to Natalie Eisensee, also a past president and phenomenal veterans advocate, active in so many aspects of the veterans community. At the same meeting, we elected two new board members. I don't think that either of them are on this call at this time. But we elected Will Funmaker is the director of the Great Lakes Intertribal Epidemiology Center and the executive director of the Great Lakes Area Tribal Health Board, and Bill Matthews, who's an employment training specialist at the Wisconsin Department of Workforce Development. Both are veterans and bring skills, experiences, and networks that we are excited to work with. You can learn more about both Will and Bill by visiting our website, and that is vetscan-wi.org. So if you read our newsletter, you may recall that we conducted a survey to help inform how we engage in the future. And we appreciate the feedback that we received, and we'll likely be doing more of these types of surveys in the future. And they're really brief, not, I think it was like kind of the goal was to be able to finish it in like 4 or 5 minutes. If you haven't received our newsletter, please check your spam folder and add info@vetscan-wi.org to your safe senders list. We do use a mail service. We use MailChimp mail service, and a lot of email service providers kind of will read that. They know that it's coming from MailChimp, and so they'll direct it to a spam folder. So again, our email address is info@vetscan-wi.org. And you can communicate with us that way too. Shoot us an email and provide us any thoughts that you might have. Also, I just want to remind or let you know if you're not aware, but VetsCAN is operated exclusively by volunteers. We have no staff, so everything we do is done on a voluntary basis by individuals that in some cases have full-time jobs too. So, or other responsibilities and other commitments. So if you have um, a skill, and most of us do, a skill and even just a couple hours a week that you could join us in our efforts, please reach out because we would love to just help um, kind of spread the, what is that old adage? Many hands make light work. Um, so it'd be great to lighten the load for some of the volunteers that are working hard to produce these programs and other other activities that we're involved in. So today we've got representatives from the VA hospital and the Wisconsin Department of Veterans Affairs. Um, oh, before we get into that, I should just ask, are there any questions that anybody's got related to VetsCAN, our organization, or upcoming activities, anything like that? Okay, I don't hear anything. So, um, we've got first up, Abe Rabinowitz is the Associate Director of the VA Hospital in Madison. He's joining us and is able to provide some updates from the hospital.
Yeah, thanks very much, Kathy. Appreciate it. Appreciate the opportunity to be here with all of you to provide a couple of things that are going on here at the hospital. First, we did have our quarterly teletown hall earlier today. This is an opportunity we take to reach out. We usually call about 10,000 veterans who we serve and offer them the opportunity to get on an hour-long call where we share some information about new programs and other opportunities for veterans to engage with us with their care. And then we do an open Q&A. Today we had about 1,000 people join, 1,000 veterans joined us today, which is a wonderful showing. We always hear a lot of feedback on these calls, sometimes with people who have complaints about service, and those are things that we need and want to hear because they help us to improve and get better. Also a lot of compliments, and those are always just really refreshing to hear too, to hear about where we're doing a good job. So it's always a good way of us reconnecting with veterans over that hour, sharing good things that are happening at the hospital, giving updates on things like transitions, and then getting some feedback. So that was earlier today. Also wanted to report that we have announced the latest inductee to our Hall of Heroes. This will be a posthumous induction for Army Private First Class Dennis Stoppleworth, who will be inducted on Friday, May 23rd at 11 a.m. And I think, Kathy, what I can do is send the press release that we put out for this to you so that you have it and can circulate it. Our Hall of Heroes inductions are always just a great way to recognize the service of veterans who serve the Madison community and to honor them permanently on our wall. So we're really looking forward to that in May. I also want to make sure everybody's up to date on where we are with our Fisher House. We have posted an intent to acquire property in Middleton, kind of in the Deming Way area near Costco, to purchase land that will allow us to do pre-construction and then build a Fisher House. We're very close, very close. Nothing's final until there's ink put on paper and sellers and buyers agree, but it seems like it's going in a positive direction and that we're at the final stages for that. So we're really anxious and looking forward to sharing information on next steps with the VetsCAN moving forward. Once we have acquired the property and we begin talking about construction timelines, there are obviously going to be a lot of, great ways for the community to get involved in supporting the Fisher House and really making that just a wonderful asset and resource for veterans who are visiting Madison for their care. And we have a lot of them that do come from out of town and could really use the Fisher House here in Madison. Last, I want to just quickly touch on some of the transition related issues that we've been managing. Just from a budget standpoint, if you're following the news, you know that the most recent continuing resolution passed. In that continuing resolution was additional funding for VA. So we've been tracking budget concerns all year. That should significantly help us to mitigate deficits here at the hospital. Of course, we're also working on a number of implementation of a number of executive orders that have come through, just like every other federal government organization. Major ones we're working on right now are return to work. We'll probably be moving about 200 people who are engaged in regular and recurring telework and bringing them back to campus in the next several weeks. So we have quite a bit of space planning and other activities going on to accommodate everybody, but we believe we're on track to do that. And of course, there has been national news and attention on the agency restructuring plan and possible reductions in force. I don't have a lot of or any real detailed information for the VetsCAN right now on that plan, other than to acknowledge that VA has submitted its plan to OMB. And there are timeframes for OMB reviewing, providing feedback on that plan in the next several months, with the intent to have that plan completed in June, with implementation to begin between June and the end of the fiscal year. So quite a bit of activity surrounding all of those different areas. I think what we're trying to communicate to all of our stakeholders is that, you know, with all these changes, we absolutely, positively, 100% remain here and doing everything we possibly can to ensure that any of these changes are invisible to our veterans and our patients, so that we honor them as we always have with exceptional healthcare services. And at this point, we haven't had any significant disruptions to our ability to do that. So I think those are the main items that I wanted to share with the group today. I'd be happy to take questions from anybody.
Anyone questions? Abe, are you getting off easy today?
Not that easy. No,
I don't get off easy many days around this.
this is Connie, and I don't want to lose this opportunity. So I'm going to say thank you to everyone around the table who's been involved with the VetsCAN from the very beginning, and that would include you, Abe, and Joy, Kathy, when she was the Assistant Deputy Secretary, and Joey in your role as the next person in Kathy's shoes at WDVA. The level of support and partnership and collaboration takes a lot of time, and you guys are all so busy. So, you know, knowing that once I turn over Zoom, I'll be coming to these meetings strictly as an attendee and not managing any function, which will be a blessing for everyone when I'm not doing the tech stuff. I just want to say thank you, because you guys have been tremendous, and you are. I think I recognize, maybe not fully, how much is on everyone's plates with all the changes that are happening, and to keep morale going and to stay invested in this such an important mission for veterans and caregivers and service members and survivors. Thank you again to everyone for all you've done to support this. And we may have a couple new folks on the call, and I'm hoping, Kathy, they get a chance to tell us a little bit about who they are, and maybe a chance for them to learn a little bit about us at some point. But thank you again, particularly Abe and Joey, for everything.
Yeah, if I could just add before I turn over I guess it's a microphone, just a sincere appreciation to this group for your ongoing advocacy for veterans in the Madison area and your support for our hospital. It means a tremendous amount to have people in the community who recognize the value that we deliver for veterans here in the hospital, and to extend that caring to people in the community, and really to look at where there are gaps in the services that we can provide, and to take, you know, positive steps forward to bridge them. Everybody who's on this call could be doing other things, and we just appreciate everybody taking time out of their schedule to be here to listen and to do what you can to help support veterans in our community. So thank you.
Okay, thank you. Thank you, Abe. Joey, what's new at WDVA?
What's new? It's budget, for us here. This biennial state budget is, sort of taking up most of our time at the moment, so, wanted to give you a brief update over the first one I'll talk about is the executive budget, which is the ongoing spending year to year. And our number one priority that the governor sort of agrees with us, the thing we asked for was funding for our expanded Veterans Outreach and Recovery Program. As you've probably all heard, maybe on this call or others, the VORP program was expanded using ARPA dollars from 11 regions to 16. And we brought on 2 extra clinical coordinators, and that allows us to help veterans in need faster and more efficiently and get them into treatment or into housing or whatever it is, much faster than we were able to before. The ARPA dollars are going to run out July 1st of this year. So we have asked the legislature for GPR dollars. So that's our number one priority in terms of this budget, getting that continuing GPR funding for that program. We've also asked for additional funding for our Veterans Housing and Recovery Program, our transitional housing for homeless vets. We don't, the per diem from the federal government doesn't meet the costs of that program. And in order to continue operating the 3 sites we have, we're going to have to, we need more money from the state to make those programs operate on a day-to-day basis. And we have a big request in the budget, something a first really for WDVA that we know of. We're asking for $15 million GPR, direct tax dollars, to support the homes. The 3 homes, when we had huge censuses, they generated excess revenue that funded a lot of veterans programs. But over the last 10 years, the census has dropped and the cost of providing that care has skyrocketed. And the reimbursements we get from the feds for the per diem, the Medicaid and Medicare don't cover the cost. So I think a lot of people don't know that the state has not funded our veterans homes. I think they think that the state legislature has supported them, but they haven't. So this will be a first, and we don't know how that request is going to be received by the legislature. But yeah, we need about $15 million to make the homes books balance. The governor has included a $5 million mental health grant program in his next budget, a community-based health organizations grant, $5 million over the course of the biennium. He's in the second budget in a row, he's proposed an increase for CVSOs and TVSOs. This increase isn't as big as the last one, but it is a 5% increase in the amount of money that we're able to give directly to CVSOs and TVSOs to support their operations. We've also asked for a doubling of the grant for transportation to counties that help veterans get to their healthcare appointments. We have a number of counties that don't even participate because the amount of money we're able to give out is not great. And so we're hoping to double the amount in that grant. The governor's also included a money for a extra position for the museum's oral history project, which takes stories of veterans, and they record them, but then they have to transcribe them and get them backed up and put on our site. And we've got a couple-year backup of stories already, and we are trying to broaden that program to do a better job of reaching tribal veterans. So we need an extra person, and that money is in the state budget. Those are the things that are in WDVA. For veterans, there are other initiatives the governor's increased funding for that are outside of our department that you guys might be interested in. The governor was once again talked about proposed expanding the the veteran and spouse property tax credit down to people with disability ratings at 70% instead of 100%. Hopefully that'll make it through. And the governor's proposed $1 million over the biennium for the Missing in Action program at UW, which does great work. So those are the things in our state executive budget. And then at the same time, we on a concurrent path, we talk about the capital budget, which is long-term investments. And we have a couple of big items there. Well, three, not a couple. We have, once again, we're asking for close to $100 million for a new kitchen at King at our nursing home. We've been asking for that money for at least, I think, 3 budget cycles and haven't been able to get it. And we get criticized routinely for the state of the food and the kitchen floor there, but without the legislature's approval to build a new kitchen, there's not much we're doing the best we can. So hopefully this is the time that money comes through. We've asked for, if you know our homeless program, we have 3 sites, Green Bay, Chippewa Falls, and Union Grove. The facilities that we currently use in Union Grove, well, all 3 are aged and difficult. And because of the condition of the property, we often can't keep a full house. We don't, and if we don't have someone in the bed, we lose money. So the governor has proposed $14 million for a new facility in Chippewa Falls and $10 million for a new facility in Green Bay. So we're hoping that this is the year we get some stability and some the go-ahead to build some new facilities for those homeless vets, to help them transition. And the last thing in the capital budget is the governor has asked for $6 million so we can hire a A&E firm to start the design work for the new Veterans Museum on the Capitol Square. We are moving ahead as best we can to try and make that happen. And the governor has put in $6 million in the capital budget so we can hire a design build firm so that we can be ready in probably 2 years to actually start the construction process. So those are my budgetary updates. Don't know if anyone has questions, but before I take questions on the budget, I'm going to put into the chat some information. The Legislature's Joint Finance Committee holds 4 public hearings around the state on the budget. And as someone who sat through many of those over the years, the one thing we have not had is a great veteran participation in those hearings, unfortunately. And so I'm going to put in the dates and the times in the chat. I have to do it in pieces because it's a lot of information, but I'm going to put the dates and the times in the chat. There's 4 public hearings. If people are interested and can go and spend a couple hours waiting to get in through the line, the value of a face-to-face interaction with the people who are making the decision with the Joint Finance Committee is invaluable. That really makes, for those who can't go, there's also an online portal for submitting testimony and an email address that you can submit testimony that will get distributed to all the Joint Finance members. So I'll put that in the chat in a minute, but if anyone has any questions about the budget, I'm ready. Or as ready as I want to be.
Thanks. Keith, I see your hand. I'm going to go first, though.
Okay.
Before I forget, because I will. On the VORP, how much is that request, and what's the effect if you don't get that the GPR funding for VORP? What does that mean for the program? Because we've heard over and over how important it is, how valuable the VORP workers are. And we've heard that from, I think every time I talk to a CVSO, the feedback is about how valuable that foreperson is. So what's the effect if that GPR funding isn't provided?
The effect is we go from 16 regions down to 11. So not quite cut in, a third. The wait times, and for those interested, our team has some numbers and figures, but we've greatly reduced the wait time for people to get out and meet with veterans who are experiencing crisis. And as everyone knows, if you don't get to someone within a couple hours or a couple days, sometimes the opportunity to offer help slips by. So yeah, we go from 16 to 11 regions, which means these VORP coordinators would have almost, in some cases, twice the area to cover, twice and would lose 2 clinicians. So the referrals into treatment or whether it's alcohol and drug or mental health treatment or getting them hooked up to services will also greatly increase. So it would be a dramatic scaling back of the program that we've been able to improve over the last couple of years. And it's not that much money. The sad part about this all, we asked for this money last budget cycle and didn't get it, but it's a grand total of $1.2 million over the biennium. We're sitting on a surplus of what, 4 billion?
So 1.2 over the biennium, not
Yes.
each year.
No, 600,000.
That's both years.
Yeah.
And then the mental health grants, the $5 million.
Yes.
That's over the biennium. Is that what you
It's-
said, or is that each year?
it is no, it is a one time. It's not in the base.
Okay.
Yeah, I think he recognized that trying to get a permanent program through the current legislature is difficult. So he asked for a one-time program, which with the hope that maybe, it's hard to get the legislature to commit to ongoing funding. So it's a one-time $5 million, over the course of the biennium.
And does that build on, or would that mirror the grants that you did then using ARPA funds?
Yes, it's one of the
kind of-
3. We had 3 mental health grant programs. We did a community-based mental health. We did a emergency-based mental health and an ancillary-based mental health, which was kind of non-traditional therapies. And we found, based on the interest in those grant programs and the number who applied and the money we've handed out, how hard it's been to spend, that the ancillary and the mental health grants were not as successful at getting help to veterans as the community-based mental health grant program. So the governor chose, we asked, and the governor chose to put all that money into that most successful of the 3 ARPA grant programs.
Okay, thanks. Keith, thanks for your patience. Go ahead.
Oh, certainly. Joe, your update is timely. There's currently a schedule of Veterans Day at the Capitol 2025.
Yes.
April 22nd.
Yes.
Are people aware of that?
I don't, we can't really publicize that because it's lobbying. And as state employees, so the veterans groups are doing their best. We will be participating. I will be giving a speech in the morning about effective ways to lobby legislators, since I spent 30 years listening. And the secretary will be speaking at the event in the rotunda at noon that they're holding. But yeah, like I say, we have to be careful about, since that is a real lobbying event.
I just wanted to make sure that the rest of the participants in this call are aware of it. There's a site for registration, and the areas that they are focusing on included primarily the expansion of the Wisconsin Veterans and Surviving Spouse Property Tax Credit and funding for the University MIA Recovery Project. You've just given us quite an extensive list of priorities for your department in the budget. I've taken notes as best I could through this process. Is there a summary that you could share with us?
Yes, I do have one. And it's something I've shared with the CVSOs and with some others. I will get it to Kathy and she can send it to you. I'll send 2 of them. There's two separate ones, but yeah, I will send them for you.
Okay. And I'm trying to get the word out to as many people as possible to attend that meeting.
Keith, if you can put that link for registering for that, can you put that in the chat here? So
I can send it to you if you'd like to distribute it to the group. Okay. I'm not sure quite how to put this into the chat.
Oh,
It came as
okay.
an email.
Okay. Okay, and I think that's an event largely coordinated by the VFW Legion and DAV.
Right.
So it's those service organizations working together to kind of mobilize their memberships, I think. But yeah, if we can put that, we can help broadcast that information. And oh, there it is. The nearest one to here, Joey, of those, I see there's one in West Allis. Oh, Vera, you're in the Milwaukee area, West Allis. Are there any hearing opportunities here in Madison, since so much of our group is kind of in the Dane County area?
The legislature, the Joint Finance Committee, under Republican control, has not held hearings in Madison, public hearings. The Dems, when the 2 years that we were in the majority of that brief moment, we did hold a hearing in Madison, but the current makeup of the Finance Committee does not hold a hearing in Madison. They go elsewhere. And then once they start their hearings, these are public hearings, and then they do a bunch of informational hearings where they call certain departments or agencies and they get a briefing, and then they hold hearings where they actually vote. But there's no opportunity for the public to testify at those hearings. So this is it in terms of the public being able to testify. These are the hearings. And at the end of that, I put in, there is that online portal and an email address where you can submit written testimony. But as we all know, a face and a story is more powerful than an email or a written statement, if people can do that.
I have a question for Joey, if I may.
Yeah, go ahead, Connie.
Do plans for advocating for VORP and this 1.2 million in funding over the course of 2 years, which is not much, does that include testimony by folks who have benefited from VORP officially set up to give them time to testify?
We have to walk a fine line. So we are providing information to our partners who tell us that they like the program. But for those of you who don't know, there's a prohibition in state law for state employees to lobby on behalf of legislation. And because this is a bill before the legislature, we have to be careful in how we operate. So like I say, we provide information, but we can't actually ask people to testify or coordinate their testimony ourselves.
I see. Okay, thank you for letting me know. If you need a driver for someone who's benefited from VORP, I'm your huckleberry.
Do we have any other questions for Joey? Okay, I don't see any. Thanks, Joey. Thanks for that information. Yeah, and we'll share the summaries that you send over as well. Okay, so we've got the opportunity. We can go, before we get to our special guest and our educational component, we can go around, I would say around the room, but around the screen. If there's any individuals that want to introduce themselves or their organization, or if you've got any announcements from your organization that you'd like to make, now is the time to do that. Are there any takers?
I'll say hello.
Dan, yes.
Yeah, I'm Dan Baggio. For those that don't know me, I'm the Military and Veteran Advocacy Program Director at Rosecrans, which we're headquartered out of Rockville, Illinois, but we're a tri-state area, Wisconsin, Illinois, and Iowa. And we're a CCN provider with the VA. We also are fully in network with TRICARE And we even take veterans who have a less than honorable discharge, and a lot of those are folks that are really in need. So that's one thing. If you get somebody who's not eligible for state sort of things, I'm also a peer-to-peer specialist, but you know, and I probably should put my personal cell in the in the chat, but my personal cell is 717-398-9248, and I'll talk to a veteran anytime. And if a veteran doesn't have any money, we'll take them gratis as well. So I mean, obviously, you know, yeah, we're a 501(c), and they like to keep the lights on, but I'm here to service veterans, and we'll help them anytime. And I just like to let the Wisconsin crowd know that I am a proud veteran, 3.5 years Wisconsin National Guard, and then I was 30 years active duty. So been around the block a couple of times. So good to be here. Good information. Thank you.
Thank you so much for joining us today. Anybody else?
Hey, Colonel,
Ken.
I'll jump right in after that. My name is Tori Barr, and I'm with Wayne D. Horner Memorial Stand Down Madison. I am about 3 weeks into my president-elect position with them, so really great to be here and get the invite and meet you all. Similar to what the Colonel said, we are a 501(c) nonprofit in Dane County and surrounding areas. We also work with the homeless or at risk of homelessness veterans. Also, I think very powerful is that we will also take the less than honorable as well. As it seems to be a great need for that out there. So we've been around for about 30 years, just over 30 years. COVID had some really lasting and downstream impacts on us, so we're really trying to recover from that. But we've just elected a full new board, and we have our annual event, which takes place in October 25th at the Salvation Army here. Which is the stand down day for Dane County. We have our buddies. We're going to need volunteers for buddies in there to come in and lead our veterans through. But a lot more to come on the horizon. I'm really excited to be here, excited to meet all of you, and really look forward to what we can do for the future here.
Tori, it's great to meet you virtually. Thanks for signing on. I look forward to engaging with you going forward.
I do as
Thanks so
well.
much
Thank you very
being
much
here.
for having me today.
Hey, Jennifer.
Hi, thanks. So my name's Jennifer Fisher. I'm with the Aging and Disability Resource Center of Dane County. And last month I was here and kind of talked about an issue that Dane County has in terms of transportation, where we lost a vendor. So I have asked Nathaniel Brown, who's the head of our transportation, to kind of talk about that and give a little more detail.
Yeah, so predating my time here, we had Great Lakes Dry Hooch providing transportation for veterans in Dane County, and also spouses of veterans and even sometimes other family members. Mostly medical appointments, but also other everyday things, shopping and different things. The great thing about having them was we had veteran specific transportation, where the other transportation programs that Dane County has in the Human Services Department are for a wider audience. And it was great to have something specifically for veterans. It was also great to have something specifically for veterans that took pressure off the general programs too. When we had a program that we would refer our veterans to and take pressure off everything else. So from both sides, it was really great. But we lost that. We're working on an RFP for a new vendor, and that will likely come out in April. And I don't have an exact date yet, but over the past few years, just double check my number, but there was anywhere from 1,200 to 1,700 rides provided in a year. And Great Lakes Dry Hooch had wheelchair accessible vehicles, and that was also really great, because that was somewhere that we could make sure that a veteran that needed a wheelchair accessible ride could get a ride, where there's a lot of competition for those wheelchair accessible vehicles in Dane County right now. Over the last 5 years, a lot of providers in that area have closed. So there's sort of somewhat of a shortage of wheelchair accessible vehicles, and having a spot that we knew that veterans could get taken care of was very helpful to have. That's probably the short of it, and I'd be happy to answer any questions about it.
And I just want to add, like, our hope in coming to this group is, last time it was out for RFP, we had one person bid on it who is now no longer providing service. So really trying to get the word out that we do have this RFP for services, and hopefully kind of like, once it's out, using your group to spread the word that this RFP is out there, that people could bid on.
Yeah, and we're happy to do that, Jennifer. And if I even included in the last newsletter, it included a blurb that an RFP would be coming, that you would be looking for transportation. So I think when you issue that RFP, when that hits the street, if you could give us a nudge too, yeah, we'll include that in our distribution. We're happy to help
And
with that.
Nathaniel and Jennifer, I also want to chime in there too. We at Stand Down used Dry Hooch as well as a way to get veterans with wheelchairs to our event. One thing we're looking into now is Uber has some pretty good opportunities out there for WAVs, for wheelchair accessible vehicles, and some opportunities for nonprofits. And so we're exploring that. I'm just curious if anybody has ever had any experience with that. You know, I'm not trying to derail a conversation here, but we're looking into that as well. And I'd be happy to share any information I get as we progress along these lines. But if anybody has anything up front, I would ask for your assistance there as well.
I have a question.
Yeah.
Is that RFP, is that a some certain contract, in other words, for a certain dollar amount, or is it based upon reimbursement per ride, or how does that work?
It is reimbursement per ride, is the way it's set up. Dane County's gone pretty much, for most all contracts are reimbursement for service whenever it can be.
Just one quick question. I don't know a lot about RSVP's business model, but Jennifer and Nathaniel, I do know that at one time they were very helpful in providing my son with transportation to medical appointments. Is there an opportunity to perhaps collaborate or partner with them in some way? Or
So they are providing veterans transportation. They have through their driver escort program, they call it Vets Helping Vets, that it's specifically veteran drivers, helping veterans or spouses of veterans. What this RFP would look for more, to fill gaps that RSVP doesn't, where it'd be hopefully a wheelchair accessible vehicle. That'll be a big part of the RFP, would be a wheelchair accessible vehicle. Also, some of the time frames, Dry Hooch would do trips that were outside the times of what RSVP could do, just because they only do trips when, or they only have volunteers do trips when they have staff in the office. And
okay, thanks for the extra info. Appreciate it.
So is there anybody else that's got any announcements? Because now we're running up against the clock, and we want to make sure that Andrea's got time to present and educate us on the Veteran Directed Care Program. Okay. Thanks for the great conversation too, and the information sharing. So in Wisconsin, the veteran population has a higher percentage of older veterans than compared to the national average, with a significant portion. I wasn't able to find like the pinpoint what the, some data, the data was a couple of years old that I found, but, roughly just over half of Wisconsin's veterans are over age 65. And as our overall population, veterans and civilians alike, continue to age as the so-called, the silver tsunami powers on, the demand for elder services increases at a time when traditional facilities, think, assisted living, nursing homes, are struggling to stay in business, especially in rural areas, where counties may be the sole operator and are strapped for cash and staffing. I mean, you don't have to look far to find a story about a nursing home closing, or being okay, I'll just say closing. Veterans may benefit from VA programs that support them and enable them to safely age in place. And we're going to learn about one of those programs today. So I am pleased to introduce Andrea Bonaparte, the veteran-directed care social worker at Madison's VA Hospital. She earned her bachelor and master's degree in social work from UW-Madison. So I know that she was cheering for the Badgers as they were playing earlier today. Thrilled with the outcome. Oops, Andrea brings a wealth of experience to her role, and having previously worked as a high school social worker, mental health provider for adults in the justice system, counselor for individuals overcoming substance abuse, as well as serving teens and adults experiencing homelessness. She also has experience as a private practice licensed clinical social worker, and her passion lies in advocacy, a commitment she upholds across all her professional endeavors. And she finds fulfillment in her current position at the VA, where she continues to advocate and support those who have served us. Andrea, welcome.
Yes, thank you all so much and happy Thursday. I truly want to thank Kathy and Connie for this opportunity to speak to you all about the Veteran Directed Care Program. I'm biased, not because I'm the social worker of the program, but truly it really is a great program, and happy to have this opportunity to share, to get the word out about the program. I just want to check to make sure you all can see my screen, my slides. Okay, perfect. So I'm going to turn my camera off because I'm going to be looking at one of my screens to the side, but after the presentation, I'll hop back on camera to answer any questions that you all may have. So like that was just presented, I'm going to be talking to you all about the Veteran Directed Care, or V for Veteran, D for Directed, C for Care. VDC is the acronym for short. I like to put an emphasis on that because when I first started presenting, people thought I was saying VC, like the VA Video Connect program. They're like, wait a minute, how are you? So it was a lot of confusion. So this is the Veteran Directed Care Program. So the history of the program was developed in 2008, and it's a collaboration with the Veterans Health Administration and the Administration for Community Living. And the program was born out of a very familiar, a staple program, which is the VA Homemaker Home Health Aid Program. And this is the program where the VA partners with an agency to provide in-home ADL cares for veterans. So bathing, toilets and grooming, things of that nature, and also respite services. So as I talk more about the program, you're going to hear a lot of similarities with the program because it was born out of it. And there was a big push for fiscal year 2024 for every VAMC to have a veteran directed care program. So every state in the United States, plus Puerto Rico, has a veteran directed care program. So what is veteran directed care? It is a purchase care program designed to give veterans the opportunity to receive those personal cares and help with activities of daily living while aging comfortably in their home. The veteran can hire family members and friends to provide these cares for them. Now, the program, like I stated, was developed in 2008, and it had other names such as Self-Directed or Veteran Independence Program, the VIP program. But with that directive to have a program in every VA, it was rebranded, and now it's all universally known as the Veteran Directed Care Program. So how does it work? Each Veteran Affairs Medical Center authorized an annual spending budget for the veteran based off of the veteran's assessed needs. So depending on the veteran needs, the veteran will get a budget to support their cares. The veteran becomes an employer, meaning that they will hire employees, they will manage their budget, they will decide what services and needs will best meet their cares. And they supervise their own employees or caregivers. Important to note that agencies cannot be hired with the Veteran Directed Care Program. Because, like I mentioned previously, if an agency would be hired, then essentially it would be the Homemaker Home Health Program. So when veterans hire, it has to be an individual person, an individual entity, and not an agency. So with this new role as employer, right, it can be a lot. So veterans receive assistance to manage these new employer responsibilities from care consultants, and they receive, as far as the budget and payment to their employees, they receive support from a financial management service provider. RVA at Madison, we partner with the Greater Wisconsin Agency on Aging Resources, GWAR, which some folks on the call might be familiar with. So GWAR is our VDC provider that provides veterans their care consultant needs and services. The veteran directed care social worker work very closely with GWAR to provide program oversight. And important to note that with veteran directed care program, it'll be in addition to the veterans care team, right? So we're not taking place of their primary social worker or primary care doctor. Their team will remain the same. This program will just be added to their care plan. So GWAR's role, again, the Greater Wisconsin Agency on Aging Resources, very integral to the VDC program. GWAR conducts the activities of daily living assessment. So they're going to the house, the veteran's house, to assess their needs. What is their day-to-day looking like? How much support and help are they getting or needing? They also create the budget. So help the veteran to determine, okay, I have this budget. I should pay my caregivers X amount of dollars. So they help create that budget and make sure the budget is being adhered to. And then they create care plans with the veteran. So hearing what the veteran need, right? The number one goal is I want to remain home. I don't want to go to a nursing home, or I don't want to have an agency come in to do my cares, right? So they make sure that those goals are being met. GWAR provides comprehensive person-centered counseling in the areas of financing, employee management, and also assessing the quality of care that the veteran is receiving. GWAR facilitate monthly phone calls with the veteran or their employee, and then they do quarterly in-person visits, which this is very important, where they actually are laying eyes on the veteran, making sure that they are receiving the care, seeing if there has been an increase in need. GWAR conducts background checks on all VDC employees and VDC staff. So with the program, we are not allowed to hire anyone with felony charges of abuse, neglect, or exploitation of a person. And then GWAR will enroll the VDC employee into that financial management service, right? So the veteran gets a budget. However, the money within that budget goes directly to the veteran's employees every 2 weeks with the paycheck. So the veteran would need to submit that timesheet every 2 weeks so the employee can get paid. And then with the program, taxes will be applied to the income, so employees will get a W-2. And at the moment, healthcare insurance is not available to employees of the Veteran Directed Care Program. So for me, I'm a visual person. I think this can kind of help put the program into a different perspective. So if we're looking at traditional services, so like the purple, bluish dots, the veteran is in the middle, right? And we're looking at it as a clock, 12 o'clock. The needs are being assessed. So a lot of things are being done to or for the veteran. So the veteran needs are being assessed. The veterans ask questions. The veteran is informed of resources available. The veteran is given an option of agencies to pick to get their cares from. Then the veteran is assigned and told how many hours that they can get. And then finally, the veteran is able to give some feedback. So a lot of things are done to and for the veteran. And with veteran directed care, the green circles, again, the veteran's in the middle, which is great. And if we're looking at 12 o'clock, the veteran is making those decisions, right? The veteran is hiring and managing employees or workers. The veteran is managing what the employees are doing. The veteran is evaluating the workers. The veteran is assigning the hours. You know, we may have some veterans who might be night owls. They want to have cares at night. We would definitely not be able to find an agency to do some cares at 11 p.m., right? So if that is the case for the veteran with veteran directed care, they can get those cares at that time. And then the veteran is determined what goods and services would best meet their needs. So the benefits for veterans and their employees and caregivers. So with veteran directed care, veterans are given that choice and control. So they're choosing the services and supports that they want. They're able to hire family member, friends, loved ones to provide those cares for them. They're able to live in their home and be in their community. And they're able to achieve goals that are really meaningful to them. With the program, high level of satisfaction of care. And these are just two testimonials from veterans or employees in the program. So it could not be more perfect. It's a wonderful program. I wish more people would join the program and 100% satisfied with the services. So the benefits for the VA, right? Why was it this big mandate directive to have a VDC program at each center? So choice, the VA is increasing its ability to provide the right care at the right time from the right provider for veterans. Cost, huge cost reduction, right? We know nursing home utilization comes with a big bill. So with the veteran being home and not going to a nursing home is reducing costs, reducing emergency room visits, reducing hospital admissions, reducing bed day of care. So a lot of reduction in cost for the VA. And then access to more hours. So with veteran directed care, veterans usually get a lot more hours and a lot more care versus traditional VA programs, such as the homemaker home health program. Because with an agency, right, the VA is when the agency is giving the VA their bill, you know, within that is the overhead cost, is the administration fee, brick and mortar fee, all these different fees that are incorporated in what the VA has to pay. Whereas with veteran directed care, the veteran is paying someone who most likely live with them or a family or friend. So we're not paying a huge administrative cost or brick and mortar fee. So they get a little bit more out of their budget. And then partnering with GWAR, they have a wealth of knowledge and connections to many community resources that's beneficial to us at Madison, at the VA, and also to the veterans that we're serving. So our target population, who are we looking for veteran directed care? So first and foremost, the veteran must meet clinical and administrative eligibility. So they must be enrolled in VA for their primary care. They must have that desire to live at home and must be at risk of needing some level of nursing home care. We run into some situations where like the family wants to do the program, but the veteran's like, no, and we can't enroll. The veteran has to be agreeable or they're activated POA. The veteran must have at least 2 or more activities of daily living dependencies. So they must need some help with grooming or bathing, eating, toileting, transferring, walking, things of that nature. And the veteran must have an employee identified at the time of referral. The program is called Veteran Directed Care, so the veteran must be able to self-direct their long-term services and supports. So they must be able to oversee the program. They must be able to adhere to program expectations. Now, if a veteran is not able to do so, if they are activated or have dementia or just does not have the capacity, then within the program, we call an authorized representative. This is someone who would assume the role of that employer, right? So the veteran wouldn't be the employer, but it would be this authorized representative who will run the program. It's not a paid position, but they will be the one that's authorizing the timesheets and things of that nature. and meeting eligibility does not guarantee enrollment. So I mentioned some other programs that the VA offer for veterans. With veteran-directed care, veterans will be opting out of VA paid homemaker home health services and in-home respite, right? So again, it's like the double dipping. The veteran cannot have an agency doing cares, and they cannot also pay with the VA budget to do cares for them. So they have to decide. And with the veteran-directed care money, the veteran cannot purchase care from an agency. Veterans will be opting out of VA paid contracted adult day healthcare services. However, on a case by case basis, the veteran could use some of their veteran directed care budget to pay for some adult day healthcare services. And with veteran directed care, the veteran will remain entitled to their 30 calendar days per fiscal year of inpatient respite services through the VA contract nursing home program. So, how do these personal care services kind of play out? In scenario one, we have a veteran who has been assessed as a case mixed need. That just means that they have shown some need with their activities of daily living, right? And this veteran is preferring to have to be hands off on managing their personal cares. So, meaning like they don't want to have to hire anyone. They don't want to have to figure out what hours somebody should work. Then maybe this veteran will be best, their needs will be best met with that VA paid homemaker home health program, or VA paid in-home respite, or VA paid adult day health care program. Where in scenario two, the same veteran so has the same level of need, but they prefer to be more hands-on with their personal cares, or they have someone that can be hands-on for their personal cares. And they have an employee. So then maybe veteran-directed care would be best for that veteran and meeting their needs. In both scenarios, again, the veteran will remain entitled to their 30-day contract nursing home respite stay. So if you know a veteran, or someone that's interested in learning more about the veteran directed care program, the first step would be for the veteran to connect with their PACT social worker. Because ideally the PACT social worker would know the veteran, know a little bit about their situation, and can assess and help them determine which program would be best for them, right? And if after having that conversation, the veteran and family is wanting to move forward with veteran directed care, then the social worker will reach out to me, and then I will reach out to the family to kind of reiterate the program, and then we'll get the enrollment process started. And these are some resources about veteran directed care. Really, really great program, really great read. At our VA, we currently have 58 veterans enrolled. And like I mentioned, the program been around since 2008. So other VAMCs have a more established program and a bigger number, but we are working to grow and making sure that all veterans in the Madison catchment area knows about the program. So that's my last slide. I will stop sharing and then get back on camera to answer any questions.
Thank you, Andrea. So are there any questions? Connie?
Andrea, I'm a caregiver for my son through the VA's caregiver support program. And as you go through the information about veteran directed care, it seems to me that there's a lot of room for overlap, or even some worry on my part. Over time and in the future, how does the caregiver support program work or not work with veteran directed care?
Yes, no, great point. So veteran directed care, would sound very similar to the homemaker home health program. And like you mentioned, the caregiver support program, right? One of the biggest difference between veteran directed care and caregiver support, with caregiver support, you have to be that 70% service connected. With veteran directed care, you do not. Now, the programs can only overlap because it's very similar. You're paying a caregiver to do cares. The program can only overlap if a veteran has very high needs. And if that's the case, then the caregiver support social worker and myself will talk about a care plan where if with caregiver support, there are still some unmet needs, then we can have a portion of the VDC budget to meet those needs. But it's really rare because caregiver support does a great job of making sure that, you know, all needs are being met. But if there are some cases, then we will talk about how we can work together.
Thanks.
You didn't mention anything about means testing, financial eligibility.
Yep. So with veteran directed care, it does not require any means testing, but to be VA eligible, then, you know, you'll go through that process. But with veteran directed care, there is no means tested.
So if you're retired and you're getting Medicare and TRICARE, would be paying for your VA care, the hospital, you'd still be eligible for this program?
You'll still be eligible for the program if you're not using your Medicare benefits for other homemaker programs.
Thank you.
Mm-hmm. And bring up a good point too. So I do let employees know that, you know, with veteran directed care, if you will get it, you will get a W-2. So this extra income might impact not the veteran, but employees who might be receiving Social Security or SSDI or food share, anything of that nature. The extra income might impact whatever limitations that employee has, but it will not in no way impact the veteran.
Good point.
So Andrea, then the rate that's paid to the caregiver, is that just based on, is that like a Medicare rate, or is it based on the locality, or how is that determined?
So the budget is based on Medicare and locality, right? But however, what the veteran would like to pay their employee is up to the veteran within reason, right? So we look at, you know, what are local homemaker home health agencies paying their employees, right? And also knowing that this program doesn't come with healthcare benefits. So it might be a little more wiggle room with what you're paying your employee. You're not going to pay your employee $40, you know, but $20, $25, then yes, you can do that. So, for example, if a veteran budget is $2,000 a month, right, that's their monthly budget, and they want to pay caregivers $20 an hour. So you do $2,000 for that monthly budget divided by the hourly rate of $20 an hour, then that'll be about 100 hours employees in general in total can document for cares for that month for the veteran.
Other questions? So you said that you've got I'm sorry, I don't recall the number. Was it 80 veterans?
58,
50?
58.
58 that are participating. And then I guess, what's the how long, or what's on average does a veteran participate in this program? I mean, is
It's
there any limit?
it's not a limit. We hope, you know, to end of life, because it, you know, until a veteran is no longer able to stay in their home, I should say. But they get reauthorized every year, but they can stay on it for as long as they're meeting the VA criteria, utilizing the budget, things of that nature. But no, they won't get kicked off after so many years.
And these are the GWAR quarterly visits. They kind of track to make sure that the veteran is thriving to the, you know, I guess, best of their ability, given their conditions in that
Exactly.
setting.
Exactly. And then I work closely too with the PAC social workers. So if a veteran is like transitioning to hospice or, you know, things of that nature. And if needs do increase, then their budget will increase as well.
Just to reconfirm, if I could, the eligibility for this program in terms of physical disability is not age related. It could be any veteran.
Any veteran. I have veterans in the program that's in their 30s and then some that are 99. So it's all about the need and, you know, if this program would best help meet their need to stay home.
Mhm. And what I heard is that they don't need to be at a nursing home level of care need at the time of entering the program, but kind of at risk of that.
Right, yeah, and we see that a lot with our veterans who have dementia or Alzheimer's, we know that's a progressive disease, so we want to try to get them in, um, so they can benefit from the program throughout their prognosis.
And Andrea, what is the website if somebody wants to learn more, or what should they do?
So if they have a connection with their PAC social worker and they want to kind of learn more that way, just hearing about it, then they can reach out to their PAC social worker, or they can go on the ACL.com website to learn more about Veteran Directed Care Program. I'm sorry,
Is that
ACL.gov. I'm sorry,
.gov?
.gov.
Okay, ACL.gov. That's it, ACL.gov.
Yes.
Like, that's
Just
so
be
short,
simple.
so easy.
Really,
It's like,
yes.
Andrea, are there any veterans involved in Madison's 58 who are diagnosed with a serious mental illness?
Yes, and also with other conditions. So not solely just because with that and the need will have to be more constant. So kind of like caregiver support, where the veteran must show like a consistent need for at least 6 months on a daily basis. So it's very hard for like some veterans who have chronic pain. They may not have that pain every day, So if they have other conditions that we could, show a stronger case on why they need the program, but those cases can be a little bit more difficult to assess. But we definitely will give everybody the full, assessment to see what could be appropriate for them.
I always wonder about that, just to elaborate a little bit, because dealing with veterans with dementia and Alzheimer's is different than dealing with veterans with serious mental illness or moderate traumatic brain injury. They're all different breeds of cats, but symptoms can overlap in terms of cognitive impairment. So that's the reason why I focus questions the way I do like that. So thanks.
Yes. Yeah, no, definitely. And we collaborate with doctors, with the medical team as well. So I wouldn't say no, right? But I think just if someone is interested in and want to be assessed, then please go for it.
Mhm. Is there a fact sheet on this program along with the excellent briefing that you've given for the slides, but a fact sheet as well?
I have a rack card, a brochure that I can definitely send out. The ACL website they have. On the website they do have a fact sheet as well. It's general, right? It's not specific to the Madison VA, but the program guidelines and expectation is we all have to follow that. So I definitely could send that brochure and then that fact card to you all.
Thanks.
thank you so much, Andrea. At last call for any questions or comments for Andrea. All right. What a great presentation. We'll be sure to share all of the materials that you provide us on our website and through the newsletter follow-up and the recording then, of course, on our YouTube channel.
Please
So
do. Thank you all. Yes, thank you all so much.
So we've got a couple of minutes before the end. Are there any comments, any open discussion, or any introductions? Otherwise, we
You
can
have
sign
to
off.
forgive me, but I'm dying to know who David Weber is. Now I feel like I know everybody around here except David. I apologize. Have we met before?
Possibly. Dave Weber. I'm a volunteer with Team Red, White, and Blue in Madison. It's a veteran nonprofit, and then I also work for a nonprofit called the Courage Foundation. We provide self-regulation training for veterans struggling with post-traumatic stress and some moderate TBI as well. So I do all sorts of things in the Dane County area with veteran groups and projects. So
Thanks.
you.
Nice to have you here. Thanks for joining us.
Thank you.
All right. Well, if you've collected the information provided in the comments from the top, Connie had added our our email address, our website location. Joey provided the locations, times, and dates for those hearings, public hearings of the Joint Finance Committee as they look at the state budget. He'll provide me the also the link to that online portal is also included there in the comments from him, and then also the link acl.gov to learn more about veteran-directed care generally. So unless anybody's got any last alibis, I guess we'll call it a day. Thanks so much, everyone.
Thank you very much.
Take
Great
care.
meeting.
Thank you
Thank
all.
you. Great meeting.
Thank you.